about
4 years ago.
About 4 years ago, he was coming home from his own hospital and he had an accident. A drunken driver ran into him and he needed first aid and he was left on the floor in an hospital for 4 hours. How do we do this? How do we really, guard against this ineptitude in our medical professionals?
We're changing it. So for me now, it's about creating the right environment, right people.
Because a call came in, and
Okay.
Can we go over that again? How do we guide against this ineptitude and lack of feelings in our medical professions? Professionals.
So it's important first and foremost about mentoring. It's about mentoring. Who is mentoring who? Yeah. So if the older colleagues are mentoring the younger colleagues properly, this won't happen. So for me, as a personal doctor now, I'm trying to mentor my younger colleagues now, letting them understand that medicine is not driven with money. Medicine is driven by love and compassion. Money always follows those that are driven by love and compassion. You know my story, man. We've done over 3,000 surgeries in 13 states in Nigeria. We have gotten very few support. God has helped us because of our passion, our love. The funding we need for these things always come forth. So if what drives you is love and passion, the money will follow you. But if you follow money, the money will finish. So it's important as medical doctors that we must follow the core of our Hippocratic oath. As a noble profession, as doctors, then the money can follow us. That's the dream. That's the idea. Very important.
Thank you so much. One of our viewers posted this question. It says, have you ever faced any difficulties while starting afresh as a medical doctor? If so, kindly educate us.
So it wasn't easy. It wasn't easy as a doctor to start a practice because nobody gives in Nigeria. It's not a giving culture. So what I do is that 80% of my income in my practice, I spend it on the foundation. Because we must always see what you are doing as a doctor to support you. So for me, it's about driving the narrative, training narrative, driving the story. So the story will help you create a value chain. Today now, if you Google fibroids in Africa, you see Dr. Benjamin on top of it. Because we have done so many fibroids in Nigeria, in Africa. Now we are seeing patients coming from America, from Australia, from the UK, from Japan, from Sierra Leone, from Saudi Arabia, because of what they've seen us do in Nigeria. So now we are changing narratives. People are coming all over the world to see what we're doing. If we didn't put hard work into it, they will not come. So it's important. You are steadfast, you are passionate, you are compassionate, and you are driven by love and compassion. That's very important.
Okay. Do you suggest more medical practitioners to also render humanitarian service to the society?
Very, very important, because normally our job is actually humanitarian. For example, so you can charge somebody to do a surgery at 1 million, but not everybody can afford 1 million. How do you help the woman that cannot afford 1 million? So it's important we put humanitarian face to our work. It will help us, will affect more women and more children and more families, and then it will change their own lives. So it's important we should all join the race and affect more people. Very, very important.
Thank you. Now, to the young people who aspire to become a medical doctor or who aspire to become medical doctors, what is your advice to them?
Love is the focal point. Enjoy medicine. Medicine is not driven by salaries. It is not driven by money. It's driven by love. You must love love that profession, and impact must be your focus. Be impactful. Have great mentors, people that are very credible, that are very passionate. Make them your mentors and look up to them. Ask them questions. Because what I know clearly that in Nigeria, our country will be great again. Our health sector will improve again. So if you want to lock into those things, it's important to have great mentors and be passionate about what you're doing. To change your world, to change the healthcare space, passion is the key.
All right. Now, let's move away from passion. Let's talk about the real deal, which is meeting your bills. You know, a lot of doctors are living in squalor in Nigeria. Doctors are not well paid. Doctors are not well appreciated by the government. So what do you need to say? How do you balance it? Because it's not easy. Some people want to do what you're doing, but they haven't gotten the know-how. The Lord has blessed you to be able to tap into some goodwill. You have goodwill with people. You have a lot of goodwill with people, and that's the reason why you have a lot of support coming in, you know, and a lot of people, some other doctors may not have that kind of goodwill or the foresight to go the way you have gone. What do you have to say to this?
So first things first is that you must know your calling. What are you called to do? What's your calling? Are you ready to pay the sacrifice? Are you ready for the process, for the training? Because you cannot get the glory without a pain. There is no gain without a pain. So the pain is a critical process you go through to get the gain. I went through a lot of pain to get to the gain, a lot of it. But your dedication, your conscious, concerted learning through the process will bring you to your wealthy place. It's very, very important. So if you want to delve into making money from practicing medicine, I'm not very rich, but I'm not poor. God has blessed the works of my hands because I am dedicated to my work. The life of one patient matters to me. I don't take my job to play. If I'm meant to resume work at 8 o'clock, I'm there at 7:30. If I'm meant to close at 6, I close at 8 because it's the passion that will drive the work. So you're not waiting for the work to just the time to end because it's what you put into the work that you get into it. So if you put hard work into it, you get a lot of results. So my advice is very simple. Put hard work into the work because the result of hard work is more work. And when you have more work, more funds will follow you. That's the idea. That's the dream for me.
Well done. Prosperity. More, the result of hard work is more work. And when you have more work, you have the prosperity. I quite agree with you because look at me in the education space. A lot of people like what I do, but they can't do what I do because they can't do things for free. A lot of people testify to what I do in the education space. I don't ask for money. I don't put money first. Nobody can come up and say, oh, we came to her to help us, and because we didn't have money, she did it. I've always made myself available, and I'm always reinventing myself. And like you said, the passion is very important. And most of our young people only want
PhD now because you are passionate. So
I'm doing a PhD in public health.
If you are not passionate about what you are doing, you'll be going back to school.
Yes.
You're okay. But the passion for excellence is in hard work and more hard work.
That's correct. I completely agree with you.
The process is very, very important. The staying power. The staying power. You are a strong staying power. That's why we connect. That's why we love ourselves, because you have that understanding.
Yes.
And that's power. Many people want the quick win. 1 year to make money, but sometimes it takes 10 years, it takes 15 years, but staying there is very, very critical for me.
People are very surprised to see that I'm still carrying this school run brand, because school run was established 14 years ago, 2007. I mean, 2006, 2007 in Nigeria. And I've been doing it and I haven't changed. And those who know me know that I've always been in education. I've been asked to come and do other things that are more, you know, that will give me more money. But I told them, I said, no, because I believe that we need to change the landscape of education. And even this public health I'm doing it so that I can give health education. I'm not doing it for anything else, but because of global health education and the pandemic. And
I know.
I can see the synergy, you know, in this. So basically, I quite agree with you. You know, I'm your #1 fan, because from day one that we met, we just clicked. And can you tell us this many awards that you've won? Because I know you've won several awards. And can you just tell us about 5 of them, the recognition you've been given in the last 2-3 years?
So I got a lot of awards, man, lots of them. I got an award from African Youth Parliament from Kenya.
African Youth Parliament.
Got Rotary Award from International from Maryland, USA. I got
Rotary Award.
I got an award from the governor of Lagos State for doing the 100 days in office election.
I remember.
We got another award from University of Lagos alumni. We got another award from College of Medicine, University of Lagos.
Wow.
We got another award from the Rotary Club of Igbobo, and also in Maryland. So people are seeing what we're doing, and for me, I'm just grateful to God for the awards. But for me, it's the lives I've been touched. Man, lives that have been touched, I might not see some of them again. I've been to states like Cross River, Bekwara. Bekwara is the border between Nigeria and Cameroon.
Wow.
And it is 6 hours away from Calabar. Calabar is the capital of Cross River. In that place, we did 201 surgeries in 11 days.
Wow, 201 in 11 days. Wow.
I slept only 1 hour, no, only 5 hours in those 11 days.
Wow.
I was in theater almost every day, because people have not seen healthcare for a long time in those places. So for me, those lives have been touched. Those awards are just addition to what we're doing, but the lives are the most important thing. Somebody barren for 15 years, like yesterday I had a surgery. The surgery was about a lady that had been barren for 14 years that we did surgery for, you know, but now she had a baby boy yesterday. You know, so you can understand the story that happens. After you take away their mask, they get pregnant, they have children, and they pray for you. Their kids even pray for you. That's important for me.
Wow, well done. Okay. All right. So you have been able to make an impact in the society.
I can hear you.
Can you hear me now? Hello?
I can't hear you again.
I don't know. Maybe I should stop and start again. But I can hear you. Hello? Okay, I'm coming back.
I can't hear you very well again. Can you hear me?
I can hear you.
Okay. So that's fine. But I can't hear you well.
Wow. I'm thinking of ending it and coming back.
I can't hear you.
Are you sure?
Okay.
Somebody is trying to call you.
I can't hear you, ma'am. So maybe we should go and maybe we should try again.